Allora, intanto che gli speaker raggiungono i posti, questa è una lunch session, come vedete, dedicata alla Innovation of Lipobank's Method, the use of the autologous adipose tissues cryopreserved in the breast reconstruction. Sentiremo in questa sessione, avremo un saluto innanzitutto del padrone di casa, del professor Vita, e poi sentiremo una breve relazione del professor Gino Rigotti, poi sentiremo un'associazione di signore che sono state trattate con questo metodo e ci diranno qual è il loro punto di vista, e poi ci sarà qualche breve domanda per tutti gli altri speaker. Quindi la parola al professor Vita. Adesso we are going to speak in English,
yeah.
okay?
Thanks a lot. Thank you, everybody. And I am very happy to be here because I think that it's the first time that we can introduce something really, really new. It's a revolution, actually. Because you know that lipofilling is in our everyday job, and we do, every one of us do the lipofilling. It's so useful, but we have a problem that we have to ask the patient to do many sessions, and it means that they are obliged to be admitted to do at least a day surgery procedure, and then we need to have anesthesia, and that's a problem anyway. That's a problem because the patient must be accept this kind of procedure that can help, but it's the dark side of the procedure. Well, since many years, a lot of people tried all over the world to freeze the fat and to introduce back after when you need, after months, after a couple of months, the fat back. But unfortunately, all attempt didn't have any success because was not the vitality of the fat cells was not good. Well, an Italian company realized our dream, and now it's possible to freeze, and they give you back your fat with a certificate in which there is the I don't want to say yes, how much? 70%? Yes, 70. Yes, even more than at least 70% of cells that are perfectly live. And I think that it will change completely the approach to this kind of procedure. And now we started in Italy, and they want to spread out in all Europe, and it's possible also overseas. Then Alessandro Nanni Costa is the scientific director. He was the director of the National Transplant Center in Italy. It's the main institution for transplant. You don't forget that the fat that we use in lipofilling is exactly a transplant, an autologous transplant. Then it must be treated exactly like another organ. Well, Alessandro, I'll give you back the words, the microphone to say something about that.
Thank you very much. Now I have a sort of precise point to say. The scientific director of LipoBank is Professor Ventura. I am the scientific coordinator. That means that he has more scientific work to do. My work is to put things together. And now we are very happy to introduce Professor Gino Rigotti, which is the major scientist at international level, the major surgeon with more experience on this important and innovative field. Please, Professor Rigotti.
First slide, please. First of all, I want to give a look to the steps we did non funziona il...
Per favore.
Ah, no, probabilmente bisogna stare qui. Sì, sorry. A short look to the steps we did with fat grafting. At the moment, nobody exactly knows which component of fat is doing what. For this reason, I applied the simplest method for harvesting fat. That means syringe, short gravity sedimentation, and transfer from a big syringe to a small one in order to have the better distribution of fat that is absolutely important in the success of the operation. Which is the path we have traveled? First of all, we have to remember Coleman, because from Coleman we learn that it's possible to restore volume, but mostly with predictable results using the fat grafting. And in this way, we learned the filling, that is something very simple, how to fill something which is absent. In 2005, fortunately, I discovered the possibility to treat radiotherapy tissue damage with fat grafting. And this process was mediated by adipose-derived adult stem cells. In this way, we learned that fat can induce regeneration. What means regeneration? For instance, just to show you a case, a patient who had radiotherapy and she had the extrusion of the implant, and with the injection of fat, we are able to heal the wound and to get a acceptable morphology of the reconstructed breast. But what is important that we changed the quality of tissue, transformed in the radio lesion in absolutely normal tissue. And this is valid also for even other situations like wound from HIV, diabetic, ischemic, and so on. Non funziona bene. Ecco qua. But we take care even of in other important disease like Romberg disease. And from the first picture, the one on your left to the one of your right, crossed more than 10 years. Because at the beginning, the girl was 8. Now she is 18. And you can see that the result is maintained the same in this long period. Another important fact that we found is that fat is able to rejuvenate the skin. And we did a clinical trial, and we found that after fat grafting, there is a revolution in the elastic fibers, which are transformed from old to young elastic fibers with the clinical aspect of coming from this activity. You see before and after. It's very evident how rejuvenation can happen. The following step was mostly when we have to reconstruct an anatomical region, we need to give a morphogenetic. We need to obtain what we need, the aspect and so on. And we found a way to apply a biological morphogenetic surgery. That means a shape obtained not cutting or adding a flap, but just influencing a biological mechanism. And this is obtained addressing the synergy between minimal surgery and the interaction between resident versus injected fat. The morphogenesis is the ability to give a predetermined shape. We need 3 important things. First, rigotomy. Rigotomy is performed by a needle. With the needle, we can create small spaces in all the direction in the subcutaneous tissue in order to create a 3-dimensional net that can be filled by fat grafting. The other important thing is what I call the scraping rigotomy. Scraping is injury given with a special cannula with cutting wing in the surface to injury the deep layer of dermis in order to create a scar, simply a scar, immediately beneath the skin. The third, of course, is fat grafting. Just an example, in this patient we have to enlarge this area so we can induce a morphogenesis in augmentation. How can we do? Fat grafting, rigotomy. Rigotomy is waking and breaking the matrix, creating a mild injury with a mild oxidative stress. The long-lasting reshaping is the creation of a pre-adipogenetic environment. That means mass and volume, angiogenesis without fibrotic response. And the result is the enlargement of tissue. On the contrary, on the opposite breast, we need to reduce. To reduce, we don't do, of course, fat grafting. We don't do only scraping rigotomy. In this case, we are creating a major oxidative stress, creating a profibrotic environment. That means fibrogenesis, enhancement of granulation, in one word, reduction. And this is the result before and after without creating any kind of wound. Non funziona bene questo. Another application, ptosis is the relationship between nipple areola position and the position of the submammary crease. With an expansive morphogenesis, we are able to have an elongation of submammary crease. Elongating the submammary crease, we change the relationship between nipple areola and the submammary crease itself. We are correcting the ptosis without any open surgery. And for the same reason, we can build a new breast even beginning from such a scar situation after radiotherapy. And step by step, we are enlarging, creating new space, changing the situation, and arriving to a final breast reconstruction with very nice characteristics. Another important thing, when we are doing this kind of surgery, remember we are doing for life. And this is the demonstration. A patient who had a left breast with a tuberous disease. You can see the result immediately after the end of surgery. 8 years later, the patient was pregnant. And even with pregnant, the hormone are stimulating in the same way the reconstructed breast with fat and the normal breast. And if you see 14 years later, with the aging process, we have an increasing of ptosis, but symmetrical with the contralateral breast. Can you imagine what could happen in a patient like this treated with an implant? Okay, fat grafting allows fantastic results, but the high number of procedures is a big problem, both for patients who needs to go in the operating theater several times, and of course even for healthcare, public and private institutions. Solution. We have the solution, LipoBank. LipoBank is able to do fat tissue cryopreservation, and it is another important thing is that it's a public-private partnership because it is working. There is a cooperation between LipoBank and the Banca della Cute RIR, Regione Emilia-Romagna. And this is the best way to do this kind of thing. LipoBank is sure, innovative, because it has a biological assess that is completely safe. we are sure that the number of cells and the vitality of cells is okay. We are doing histomorphological investigation in any case, and we can guarantee sterility. And this is the LIPOBANK. The bank is in Cesena, and it is related to Ospedale Bufalini of Cesena, and it is at the moment the biggest bank, skin bank in Europe. We did a trial, but before doing the trial, we got a look to the morphological structure of the tissue. And you can see these are a completely normal adipocytes. You can see cytoplasm is perfect without any interruption. The vascular stromal space are okay. The components are okay. And even if we go deeper with the electron microscopy investigation, again, we can see that the cytoplasm is perfect. Vascular stroma space is perfect. The vessel inside the vascular stroma space are absolutely normal, like fresh tissue. And for this reason, we started the clinical trial, trying to compare fresh with the cryopreserved fat. What we did? An example of the study design. For instance, the patient must perform 100 cc of fat grafting for the normal reconstructive process in the inferior quadrants. First operation, we take 150 cc, and of them, 10 are injected immediately, 100 are injected immediately, and the remaining 50 are sent to the bank for the cryopreservation. 3 months later, the second step, the patient needed to do again 100 cc, but of this, only 50 are harvesting with liposuction. The remaining 50 are coming from the bank. We injected in separate quadrants in order to investigate and to see any difference between them. These are the patient. Fat is harvested in the same way as I described it before. The only difference is that half of them was shipped to the LIPOBANK for cryopreservation. This is the package coming back. We fill the syringe, we distribute the fat, separating the area, the quadrants in which we injected cryopreserved and in which we injected the fresh fat. This is the result picture. Even with this picture, you can see the major bulging of the breast, but in any case, we did pre-op and post-op investigation. This is before on the left, and you see that we have an increasing of the thickness, absolutely similar between fresh and cryopreserved. We are able to calculate the volume before 590 and after 655, approximately the fat we have injected. And we have a new technique, which is an ultrasound panoramic view. And it is important because one of the reaction of after fat grafting is the softness of the tissue. And you see that before, you can see something irregularity on your right, on your left, that is absolutely straight after fat injection, and is absolutely compared with the fresh fat. In summary, we are doing fat grafting. We are able to generate anatomy plasticity, that means volume. We're able to repair the tissue and to rejuvenate the tissue. The problem, the number of procedures solved by cryopreservation. In summary, I think that cryopreservation is one of the most important turning points in the history of fat grafting. Because we can do one liposuction and multiple fat grafting. That is absolutely important because liposuction for fat grafting procurement is the most invasive and painful surgical step intra and post-op in the surgical procedure. It requires, that important, at least major sedation or more with the presence of the anesthesiologist. It requires garment of 3 weeks after surgery, and it requires home convalescence. Fat grafting without simultaneous liposuction can be performed under local anesthesia or thoracic nerve block, eventually with very light sedation, as outpatient surgery, does not require convalescence, and finally is much less expensive, which is the last but not the last situation. Thank you for your attention.
I think we are surprised but very, very satisfied about such result, which unequivocally demonstrate that the results, the condition of the transplanted fat after cryopreservation are identical to the fresh fat injected in the breast. Now I am asking to Professor Davide Melandri, which is professor at the Bologna University, and the new position of Bologna University in Romagna, and we now remember all what happens in Romagna a few days ago, and we are close to Professor Melandri, which house was injected with water. Really, it happens, it's going this way. And now I'm asking you, what does it mean to be a public bank cooperating with this program or LIPOBANK, and which is the main factor of this success cooperation?
Thank you, Alessandro. It is a good question because it's not so frequent that a public health system has a sort of cooperation, formalized cooperation with a private institution. I guess that this is one of the first experimental experiment in an experiment, and we did it in Romagna. We have an experience with skin tissue. Our skin bank is working in skin for many years for the burns patient. So we were prepared in skin cryopreservation, maintaining skin cell survival. You need to have some freezing curve that have to preserve the vitality of skin for the patient, for the big patient with burns. When 2 years ago, it happens 2 years ago, LIPOBANK came in our bank and asked if we could cooperate with them in cryobanking, treating with cryopreservation and banking the tissue, the adipose tissue, and the cell of the adipose tissue. It was challenging for us, but we accepted this request, and we started to cooperate with them and to see in a way of convalidation of the method of cryopreservation, just to see and to check that was proposed to us was correct. And we saw that we have the preservation of vitality. Thank you, the study of Professor Ventura. And you can find also publication, scientific reports on this fact. And now we are working on this, and we are receiving adipose tissue from patient. Is autologous, is an autologous adipose tissue transplant. We operate on the adipose tissue. We cryopreserve in liquid nitrogen, and then we have some aliquots of tissue. And when the patient need, or the surgeon need to treat the patient, ask to LIPOBANK and to us the aliquot of adipose tissue, and we send it. Obviously, we consider that this adipose tissue has to go in a patient, is treating a patient, so you needed to consider all the security, all the fact that you don't have bacteria or other contaminants in this product. You should guarantee all the way of the production. So now we are trying to go ahead in this adventure.
Well, this adventure until now is a nice adventure, and we have very good expectation also for the future. Professor Ventura was cited from Professor Melandri. Caro Ventura is full professor at the University of Bologna of molecular biology. He will speak now about how we can, on the biological side, obtain such good results. Carlo.
Well, thank you so much, Alessandro. It was quite a long journey because the adipose tissue is quite a complex structure in the environment. So it's not dealing with the cryopreservation of isolated cells or stem cells like it was done usually before. But it is a complex structure because what we call the stromal vascular niche, it's really a topography where many cell types are embedded within. The vascular structures, these are peculiar vascular structures with almost a virtual lumen, which is split around adipocytes and pre-adipocytes. This must be preserved. And within this thick vessel wall, pericytes are residing, and these are the true main precursor cells for what we call adipose-derived stem cells or mesenchymal stem cells. There are also macrophages, and what we know from experimental biology studies is that what we call the stem cells are very sensitive to their own microenvironment, which means they sense not only the chemistry, but even the physical cues of the environment where they are growing. And Professor Rigotti said very well, this is a matter of morphogenetic environment. So in order to rebuild the tissue, the stem cells, they need to create a proper shape. And they start by feeling and perceiving the structure of their own microenvironment. So it wasn't a challenging issue, the one of preserving the stromal vascular fraction, the stromal vascular niche, and so this complex microenvironment. So we started with playing with different concentration of cryopreservant agents that may enter the cell and protect the cell from the inner environment, like the methyl sulfoxide, but also with sugars and trialose, for instance, that can shield the cells from outside. And by finding the proper relationships and the proper ratio of this component, we succeed in having a cryopreserved tissue that was then committed to the final step. After cryopreservation, the tissue must be thawed, and the resultant tissue must be similar, if not even superimposable, to the fresh one. The thawing of the tissue is also very delicate step because it needs to go from the withdrawal of one of the components gradually, keeping at the end of the day the trialose inside, then removing itself. So it's a gradual withdrawal of dimethyl sulfoxide in the presence of trialose, and these steps must be accomplished very, very carefully. So at the end, we came up with a cryopreserved tissue that, after thawing, was not only preserving the identity and the vitality of its own embedded cells, so the pre-adipocytes, the adipocytes, the pericytes, the mesenchymal stem cell component, the macrophages, but it was also retaining all the features of the original tissue. So we were able to give back, after cryopreservation and thawing, exactly what was present in the fresh tissue. So the structure of the niche, the so-called niche, so the capillary architecture, the continuity of the vascular bed, and the presence of all the components that I named. So for us, seeing that in other hands, this procedure could be confirmed and validated was very important, as it was the finding that even in vivo, in patients, now we may say that we don't need to repeat so many times the liposuction. I'm also thinking at other clinical conditions like the vascular peripheral diseases, where patients are treated with anticoagulant drugs, and this treatment cannot be stopped. So this can make the difference of giving back the tissue when it is mostly needed. To this end, we're now perfecting another approach, which is based upon the detection of vitality of the tissue with hyperspectral imaging, which allows almost real time to assess whether or not the tissue is vital. Okay, so I'm done. This technology may allow the following in vivo in patients, how the tissue is regenerating following the first or the second implant, and then deciding when it's needed based upon the characteristic of that patient. Thanks a lot.
Now, before to give again the word to Professor Roy De Vita for a new proposal, I will ask to Professor Giorgio De Santis, which is the Dean of the Faculty of the Medicine in the Modena University and Director of Plastic and Reconstructive Surgical Department, to say 2 words on his particular experience on the fat, on the use of the fat of adipose tissues.
Thank you.
Just 2, and my excuse, Professor.
Thank you. I don't have much to add to the scientist of this new technology, which is very useful and opens a lot of new idea. Just to say that in my unit, we have the Italian referential unit for the sclerosis systemic, which is a skin disease which sometimes makes the face completely amemic and the hand completely glyptotic, and the treatment is again very useful in subministration of adipose tissue under the skin with a very good result. And in this case, the proposal of the cryopreservation could be very much beneficial, because this patient has to come several times, maybe sometime 4, 5, to do face and hands, and we do a lot of amount of fat. And with this procedure, the way I convinced the administration to this model was that they save operative time in normal rooms, the one that cost a lot with the instrumental nurse, and they shift only the first operation in the big rooms, and then we moved all the other operation in ambulatory regime, which is a lot. Is not about only money, but you save hours of big rooms for maybe bigger operation, and you move to the ambulatory regime, several returning of the patient in this way. It's very, very important.
Thank you very much.
Well, the problem is to start with the right step, and the best way to do it is to realize a protocol, how to treat how to harvest the fat. And then we have the opportunity to have with us Professor Gino Rigotti, and he is so well known and well regarded all over the world when we talk about lipofilling. Then I think, without any doubt, I think that all the colleagues will be, for sure, will agree with me that Gino will arrange the protocol. I think that the best thing to do is to write down how to do it, what are the diagnostic instrumental investigations that we have to do just to check and to assess our results, because the best thing to do is to publish something, to make to face this topic from a scientific point of view, and then to develop something that can be replicated easily by everyone, because our aim is to involve the highest number of people possible all over the world. And then I think that the LipoBank Academy that will be created very soon, the first step and the first aim is to realize the protocol.
Thank you. This is a brand new idea to work at national level, but maybe in the future also at international level, with the same protocol to the same study. The public bank ensures us the traceability, so by law we are obliged to know who is the receiver of the transplant, and we can have a national registry, or maybe in the future even an international one. And the Academia of Lipofilling will be the structure dedicated to education, where new surgeons with young age, not like us, can learn this technique and can enlarge the use. It's a simple technique. Just freezing the cells, we can do repeated, easy treatment in the patient. Now, speaking about the patient, we have two representatives of an association which is called, in Italian, AIRIA. And this association is made by women that receive a transplant of his own fat tissues. So I am asking them to say 2 words about this national project that we are going to start. Please.
I'm sorry, I speak Italian to be more clear. Thank you. Io sono una rappresentante dei pazienti del dottor Rigotti e della testimonianza della tecnica da lui usata. Nel 2011 ho avuto una mastectomia e ho avuto una mastectomia e mi hanno ovviamente voluto fare la ricostruzione, che io ho rifiutato la ricostruzione con la protesi perché già non la volevo in primis, e mi hanno proposto il lembo piuttosto che la protesi. Avevo accettato il lembo. Poi sono riuscita a trovare la tecnica del dottor Rigotti, il dottor Rigotti in particolare, e ho iniziato il percorso, finito, completato in maniera direi felice e soprattutto soddisfacente, perché è una tecnica che effettivamente ridà alla donna non solo la naturalità del seno, ma soprattutto ridà la sensibilità che con la protesi non si può avere, e soprattutto anche la naturalità e la definitività, perché io dopo anni, ho finito nel 2015, sono nel 2023 e la tecnica è ancora attiva e perfetta, e tutto ciò mi ha indotto a fare un'associazione per la divulgazione di questo metodo, che effettivamente non era conosciuto. Mi sono resa conto che pochi lo sapevano. Ho aiutato moltissimi tantissime persone a adottare questa tecnica, e con questa mia associazione, quindi AIRI, Associazione Italiana Ricostruzione Innesto Adiposo, abbiamo fatto, assieme ad altri colleghi, abbiamo fatto tanti convegni, cosa che continueremo a fare anche dopo questa grande innovazione della crioconservazione, che ridurrà e soprattutto risolverà anche il problema della lungaggine cosiddetta da la maggior parte dei tecnici nella tecnica del dottor Rigotti, cioè nella ripetitività delle operazioni per arrivare alla definitività. Questo sarà ridotto assolutamente e sarà una cosa meravigliosa, anche perché questa, secondo me, secondo noi, siamo tantissime, ho fatto una rivoluzione, una piccola rivoluzione in Italia, abbiamo iscritti da tutta Italia, e iscritte ce n'è sempre tantissime, alle quali non riusciamo neanche a rispondere, collaborando quotidianamente con il dottor Rigotti. Adesso penseremo appunto di fare un altro convegno nazionale per poter divulgare il metodo, e non ho ancora trovato una di loro, e sono migliaia in questi anni, e più di centinaia le nostre associate dell'associazione, che non abbiano avuto la soddisfazione nel metodo, a parte qualche problemino lungo la corsa, però veramente deve diventare il metodo. Perché? Perché questo ti permette, e l'ho visto sulla mia pelle, di dimenticare la malattia. Questo è l'unico metodo che ti permette di dimenticare la malattia, perché ti guardi allo specchio e non te le ricordi più. Grazie.
We heard very nice and convinced word from this lady. She's an advocate, and so she's speaking about her experience also, and we are happy about. And now we have a nice parterre, and I will just to take the name of the people that are here and asking them what do they think about the proposal of Professor De Vita. So the first, let me say before all the name, and afterward I will ask to you, what do you think? The first is Professor Michele Riccio. He works in Ancona and is the founder of the Academia of Lipofilling. The next is Professor Pier Camillo Parodi, director of the Specialty School at the University of Udine and professor in the University of Udine, and Professor Angelo Trevisono, which is a specialist working here in Rome, and Professor Pirrello, that work in Sicily, in Palermo, in Ospedale Civico. And to him, just a question, what happens when can a woman can be operated in Sicily and save and store the cells, the adipose tissues in the bank of Cesena? What do you think about?
Then, I am younger in this adventure, but I wish that this lipobank we can do in Palermo. When you are at a beginner, a lot of problem can be to do. But when you really believe in your project, in your works, it's very easily, all is easily.
We are happy to hear that the project is to create a new bank in Palermo. It's not the only one that we are thinking to have in Italy. And this, so we hope to enlarge and to have the possibility to store the cells in more than one bank. Now I am asking to the other three scientists, professionals that are with us, what do they think about the proposal of the protocol? And after we will close. Please.
Of course, I totally agree about to propose Gino Rigotti to create this protocol, because he's the best expert, not only in Italy, but an international expert in this field.
Professor Parodi, please.
Yeah, thank you. I think we have also to consider the other face of the moon. I mean, you have one only one operation for liposuction. That it means that you have a fast recovery for the ladies and a beautiful modification of the shape in one time. This is very important because it reduces a lot all time for recovering, but also the aesthetical situation. In some situation, we had to take out the fat from the flank and to wait 3 months for the other one. So we are producing asymmetry, not a beautiful result. So it's a great thing, I think.
So I have to say that Lipofilling Academy is ready to give its contribution to this protocol, to this research that is very important, in my opinion, by preclinical and clinical assessment, because we have to show this that this big innovation, very important innovation, can give a great, important advantage to our patients. Is very important. Also because in my hospital we perform a lot of breast reconstruction by hybrid reconstruction or just alone with the fat, and this is the first step of the future. The regenerative surgery is the future, I think.
So we are at the end. I would just remember that other important scientists and surgeons are with us, like Professor Annalisa Curcio and like Professor Nava from Milan, Maurizio Nava from Milan. At the end, just want to say, this is an ethical procedure. It's an ethical procedure because give beneficence to the patient, reduce the cost of the cure, and give a more quality of life. And we heard, we heard about it, and this is important. Our ladies testify clearly that their quality of life increased significantly. And with ethical signature, we conclude. We can conclude. I give again the word to Professor De Vita for giving us.
Thanks a lot, Alessandro. Thanks a lot, everybody. And we are ready to start and to share with you all the results that we have and to try to engage the most people that we can in a very near future. Thanks a lot, and we start immediately on the main room with the afternoon sessions and study breast surgery. Thanks a lot.
Give it up. Let's get out of here. Let's find a new career. You be famous and I'll disappear. concern of theirs. The world outside corrupts my child, so trust these eyes. Faith is in your soul, within these walls. Hormones stall, dogs will crawl. The vices and the down